Hello and welcome to In Conversation with the history holders of the American Dance Therapy Association, a project made possible by the Marian Chace Foundation. My name is Dr. Jacelyn Biondo. When I first conceived of making these videos, I hoped to capture the words of the women who studied with the firsts in our field: Marian Chace, Trudy Shoe, Mary Whitehouse, Alma Hawkins, Blanche Evan, and Lillian Espinack. What culminated in the process was an opportunity to have these women share their stories and their memories in their own words, and to capture these parts of history for future generations. Thank you for joining us, and I hope you enjoy our conversations. I'd like to welcome today Susan Imus to conversation. Susie, thank you so much for being here with me.
Thank you, Jacelyn.
So I'll jump right into our questions. The first question I have for you is if you could share with whom and where you first studied dance therapy.
Well, I actually was in a graduate certification in creative arts therapy program through Drake University in 1979. And my instructor there was an art therapist. So I had 2 years of a graduate certification under the direction of an art therapist, but she brought in a few guests, and one of the guests was Lenny Deal. So the first dance movement therapist that I met was Lenny, and then from there, the next dance movement therapist I met was William Freeman. And William Freeman is the one who set up the program for continuing education through the University of Kansas, where I met Trudy Shoe. So Trudy Shoe would have been like my third or fourth dance therapist that I met, that I was introduced just, to little bits and pieces of dance movement therapy. It wasn't a master's program at the time.
And can you share a little bit about what drew you into the field of dance therapy?
Well, I'm a dancer by training, and I had been in a couple of, 3 different dance companies in my youth, and I wanted to actually go professional. And my father said, no, you have to at least give 2 years to college. So I first decided to major in dance, and that didn't last very long. I lost interest in the RAD method, the Royal Academy of Dance method, because my background had been Cicchetti, and I didn't realize that I would be that unhappy with RAD. And I studied nursing for 2.5 years. Then I found art therapy after I graduated, and art therapy fit my needs because I also dabble in art and I dabble in theater. So I thought I would just practice as an art therapist, and I was hired from my internship in doing art therapy at Northwest Community Hospital. And I got laid off because I wasn't board certified. So then I thought, well, I will go and get my certification as a dance movement therapist and honor my original art form, which is dance.
And so then can you share a little bit about when you started studying with Trudy Shoe?
Sure. I was doing the graduate certification in art therapy through Drake University, and my instructor at the time shared with us a handout. I happen to have all of this right here with me. And these were a number of intensives. You can see it's quite torn and fragile. And the one right here at the top was the workshop with Trudy Shoe and Peggy Mitchell. And Peggy Mitchell was Trudy's right hand. She was like her assistant, as well as companion, and helped Trudy. So this workshop took place on January 11th, 1981. And it was, as I said, at the University of Kansas. And these were a series of workshops that William Freeman put together to bring, the East or West Coast to the Midwest, because I grew up in Des Moines, Iowa, and obviously dance movement therapy wasn't known other than through the art therapists in the community. So I studied with Trudy at the University of Kansas for an entire week, and that included, 2 major sessions throughout the day. So we spent about 6 hours with her, and then a couple of evenings during the week, we were in conversations with Trudy. So we got to know her outside of the dance studio and learned a little bit more about her as a person.
And was that the primary time that you studied with her during that intensive?
Yes.
Mm-hmm. And is there anything specific about Trudy's teaching that stands out to you the most, either the style of her teaching or the content?
Let's see. The first thing I would say is that she was very charismatic. She was very warm and empathic and playful. And I'm somebody who's very drawn to playfulness. So I liked her style, and I liked how, very quickly I felt safe in a community, which, I was one of the youngest participants at the time. And, being just out of undergrad and in my first year of graduate training at Drake University. So I was actually with my instructor from Drake and another student. And so I was a little nervous. I remember that, and I didn't know what to expect. And very quickly, I felt comfortable, and, the openness to expressivity was just tremendous. And it was really fun because, I'd always taken character dance as a student in my youth, and character dance was probably my favorite dance form. And it felt like this was an extension of the character dance training that I was influenced by in my upbringing, because I would travel from Des Moines, Iowa to Chicago, which is where I live now. And I studied with these very prestigious and, well, they're just very well-known dancers, Walter Cameron and what was Mr. Stone? Mr. Stone and Cameron is what we called them. Bentley Stone and Walter Cameron. And the fun thing about that is I later learned that Alyssa White studied with Stone and Cameron. Then another dance movement therapist, Stacy Hurst, studied with Stone and Cameron. So all three of us had this very traditional character dance training that Walter Cameron was known for. And so Trudys Work felt like an extension of that, except I remember it got more psychological, and obviously it was an opportunity for me to self-reflect. Whereas in my earlier training as a character dancer, I wasn't personalizing it. I was doing an art form.
Can you talk a little bit more about the psychological components that you would say that shifted from character dance to studying dance therapy with Trudy, like what that looked like or felt like with her training?
Trudy specifically would talk about different feelings and emotions. Like we spent a lot of time dealing with anger and holding on and letting go. And how did that occur in the body, particularly with split tensions. She talked a lot about that, and we moved split tensions many different venues. Also fear. She talked a lot about fear and how we moved our fear. She also talked about joy, and her joy was so palpable. And I can still remember, her looking up, and she had this twinkle in her eye, and my response is, this woman is so filled with joy. Yeah, so I felt really honored to be in her presence and to be a part of the joy that she not only emulated, but it felt contagious in our group.
I love that you mentioned that she had you move anger, how you hold on and release it, and fear, and what some people might think of as the more perhaps difficult emotions to hold, but also that she embodied joy so purely. And I wonder if and that she also worked with the splits, right? And I'm wondering if that has something to do with how it allowed people to enter into things like enter into fear and anger. And I'm just thinking about what it's like to be a student and to be asked to enter into those emotions. And just if you could speak to that a little bit about being a student and being asked to move anger and fear in those ways.
First of all, she would relate a lot of what we were experiencing in the classroom to her work with patients. So her clinical experience, and she'd say very specifically, now the people I work with would get stuck in a feeling and couldn't come back. And she said, you can come back. So any of these feelings we enter into, just know you have the capacity to come back to your center, to that place of reality. So she was very clear that what we were entering into was not something to be afraid of, because she trusted that we would come back. And we'd explore it through the body in a way that was fun before we deepen it. And so I think that also made it, like we would go, she used humor all the time. So we would go across the floor and she'd be like, say yes with your hands and no with your feet, or be angry in your upper body, and then she'd say, and be happy in your lower body, So as we would do those body splits or those split tensions, it would seem like a lot of fun at the beginning. And then it would deepen. And then afterwards we would talk after we did some of the experientials, and she'd ask us, about how do you hold on to your tension? How do you express your anger? What is your anger dance? And even though she would give us those cues in the studio, we wouldn't talk so much while we were moving. Afterwards, there'd be an opportunity to chat. And that obviously deepened the process at that time.
Such a smart way to educate, I think, what you're explaining.
Yeah, well, she used humor all the time. I mean, I think that's the joy that I felt from her. And I love to be silly and use humor. And my students might tell you I have very bad humor, but I have fun, even what does they say about the comic that laughs at their own jokes? I guess I would say that's a style or a teaching style that I personally have always been drawn to. So I think that also added to the safety and the opportunity to start safely and then deepen the process.
Absolutely.
And
I also love this. Oh, I'm sorry, go ahead.
Yeah, she would say that she wouldn't so much go after the patients with these types of things. She said, she'd let the patients come to her with what they wanted to explore. And I think that's where there was also a difference. I felt like, she had a pretty strict curriculum with us. And even though, I never got to see her actually work like some of the other dance therapists like Joan and Joan Chodorow, she acted like, she would work more in the here and now with what was surfacing and help develop that, because she said when I was rereading my notes, she said she let the patients come to her with what they needed to explore. So in the classroom, I didn't sense that she was doing that at all. I was sensing that she had a set agenda Now, I might be wrong on that in terms of in her clinical setting, because I do know she had kind of like lessons that sometimes would occur with the patients, but as to how she would deepen with the clients, because she worked mainly with, people who had psychotic symptoms, I'm not sure how much talking she actually did with them, where she could do that with us.
Did she give you any examples of how, when working with people with psychotic symptoms, how things would surface that she would bring forth in sessions?
I mean, she would talk about them being stuck, like I previously mentioned, and I'd have to look back through my notes. I don't recall her being specific in how things, well, here, like I can just share this. So these are all my notes from when I worked with her. I had this little notebook and it's just filled with writing. And I wrote down on our breaks all the things she asked us. So like this is an example. We talked about anger and we went to complaining. We complained with our bodies, and complaining is different from anger. You complain about anything, anybody, anything in the world, show your anger and move it across the floor. What parts of our body do we use to express our anger? Throw away anything you don't want. And then we'd go across the floor and we'd do other things, leading with any parts of your body that you want to throw things away. Started with our hands. We'd go to our feet, our legs, eyes and ears. I think one thing I do want to share, though, that hasn't come up directly in a question, but when we had that evening discussion with her, I remember, because I felt so much love from her and so much kindness, and like I said, that sense of joy, I asked her, what religion do you practice, if any, or have you practiced a religion? And she said, no, I won't talk about that. She said, I believe in the religion of love. And so let me see if I can get the exact words. She said, you need to learn to love yourself and love others to become a good therapist. She said she wished that there was an opportunity where everyone could go to school to learn to love. She said the problem with children coming into the world today is the question, are parents there to and capable of love? And she said everybody wants to feel needed. So that was her answer about what religion she was. And the other thing she said, I remember her saying, everybody needs to learn to love, like Leo Biscaglia. And the funny thing is, Biscaglia was kind of an old hippie from California. And I don't remember if he had a book on love, or I think he might have had a book on love. And so he was kind of like a pop personality. So at the time, most people knew who Leo Biscaglia was. And that was like her answer to, what is your religion? Love.
So what you just shared may, in fact, be the answer to my next question, but there just seems to be, our discussion is filled with a lot of nostalgia, I think, particularly rooted in the fact that you have your actual notebooks from when you studied with Trudy Shoe. And I think these objects can hold the energies and bring a lot of that up for us. So I'm wondering if there was a fondest memory that you have about studying dance therapy, perhaps with Trudy or otherwise.
I would say that studying with Trudy was the motivation and the curiosity that really pushed me to continue and get a master's degree in dance movement therapy. In addition to the fact that the art therapy program I went through was not an approved program in art therapy. And so obviously being laid off from the hospital where I work when it got bought by a East Coast hospital, I think the motivation and the memories I had at the time, it was probably about 3 or 4 years after I worked with Trudy that I got faced with the decision of, do I go and get a degree in art therapy, a master's degree instead of a graduate certification, or do I do that in dance movement therapy? And I think Trudy was the driving force. You know, I wanted to be like her. And with her strong background in character dance, I think I felt an affinity with her because of character dancing. I ended up, you know, from her being a fabulous role model to applying then and getting my degree in dance movement therapy. So I have 2 years under the tutelage of an art therapist, and then I have two years under the tutelage of dance therapists. So I love the fact that, you know, I will use a lot of techniques from art therapy in addition to dance movement therapy. And like I said, when I talk about Trudy, I think her humor and her religious background in loving is really probably one of the most powerful motivations. You know, she said that to become a good therapist, you love yourself and love others. And no one else has ever told me that, you know, in all my training. And it's funny because I do feel, as an educator of many years, that I do, you know, fall in love with all my students. And I do feel like I love my patients when I work. I do a little work through the Center of Aging and Social Work and Community Health through a hospital here in town. And, you know, you just develop this loving feeling towards the people with whom you work. I'll never forget her saying that. And I have shared that with my students. And it was her words of wisdom that made it okay. You know, I think particularly today when everybody's so afraid of what you say and how you say it, which, you know, is definitely something I agree with. When we talk about love, it's like, do we have to be careful with that as well? I mean, obviously, we're talking about boundaries and all of that, but there's just this sense of, you know, Trudy loved life, and she had the description of the experience. And, you know, she didn't use that word when I studied with her, or if she did, I don't remember it. But she did talk about becoming one with nature and becoming one with the world. And we would move around the space and become one and feel the unity and the harmony with others. That, you know, I think was a way that she was describing not only but being in love with human nature. And at the same time, we studied boundaries, and she had us, you know, in my little book when I was reviewing that, we had a whole thing on boundaries and saying no, and how do we establish the no in our relationships. So she is equally important to love. It was equally important to also create the safety through a boundary. I just want to show this picture before we go. So you can see Trudy, and what is she doing? But she's hugging us. So I'm on the outside, and then my instructor's in the middle, and another student. So
It's beautiful.
Yeah. She was like a hug, a big warm hug, and she was just a little person. And the other thing I was struck by, she was 78 when I worked with her, and she would sit and straddle splits. I mean, not completely straddle, but she'd sit with her legs open, and she would be able to put her whole torso flat on the floor at 78. So her hip flexors, my gosh, she still was so flexible and amazing in her ability to continue to move. You wouldn't know she was 78 years old.
So Susie, I think you, in this last kind of discussion, you started talking about some parts that were really important to and about Trudy. And this next question is a bit of a big question, but it's kind of what inspired me to do these interviews. And I'm wondering if you could think about her work, Trudy's work, and describe what you might perceive the essence of dance therapy to be through either Trudy's teaching or the way that she spoke about dance therapy. I know it's a rather large kind of question.
Well, I will tell you that she said the best preparation to become a dance movement therapist is to study everything. And she believed in experience and bringing that experience to life through our bodies to relive and understand. And I would say dance movement therapy from that perspective was about bringing to life, or what I'd now say today is concretizing moments through movement to better understand them and understand how we can grow and make changes through those explorations. I kind of went away there. I was trying to put myself back in that studio. And she talked a lot about human nature and said we're all capable of moving like everything in life. And I've heard that from that's very much an influence from other old theorists. But there's something about how she was able to bring the lived experience into the studio in such a way that we would try and embody and then look at possibilities and new ways of being through our movement. And I remember she also had us, we were supposed to think about a dream that stood out to us throughout our life. It didn't have to be one that just had happened. It could be one that for some reason, obviously, it had an impact on us and we remembered it well. And we all had to prepare that dream and bring it in and move it. And once again, that's taking our lived experience and putting it into movement and dance, and then looking at it from this external position. So once again, looking at the inner, outer impact of our lived experience. And that was pretty powerful. I also remember we would dance thunderstorms, and we'd use the thunderstorm as a way to look at how our anger would surface and what was the phrasing. What's the phrasing of your thunderstorm is basically what she was asking us. And once again, you know, taking your life experience, bringing it into the room and putting it into your art form of dance, and then trying to gain a new perspective by looking at what you've created, which is really a replication of, you know, patterns in your life.
Mm-hmm. So thinking, Susie, to your own work as a dance therapist, do you have a particular patient or client experience that was really meaningful to you that you'd be able to share with us?
Oh my gosh. That's a question I always ask in supervision. To have it turned around to me is kind of fun. Well, I did write my thesis about a patient I had, but I think some of the most impactful patients were when I was very new and young in the field. I think because, you know, that's when your greatest learning curve is, and I'm like, what? You know, where am I? What am I seeing? And you know, some of the experiences in an inpatient psychiatric unit, where particularly people would enter into dissociative episodes. You know, I remember watching a patient relive the traumatic sexual abuse she had. The patient that stands out the most to me is one where I felt I made a difference. And not so much that I made a difference, but the relationship that was created between us and her growth and development was palpable. And it was palpable not only, you know, to the two of us in the relationship, but to the physicians, the psychiatrist, and some of the allied staff. And at one point, they made me the primary therapist on the team because we were making headway and things were happening in our sessions. I had a big role to play then in team meetings and staff meetings. And one of the things that ended up happening with this patient is she made a dance, and we took bits and pieces from many of her sessions, and we worked together. This is in the olden days. We worked together for 7 months. And I met with her 3 times a week. I met with her twice in group, and then I met with her once individually. So during our individual sessions, we put bits and pieces from earlier sessions together and made a dance. And that's a technique that I learned from art therapy, is you have your patient bring in all their artwork and you look at it and bring it together. And maybe if you were going to exhibit, you'd see how it would fit together. Well, we did this with our movement, and particularly obvious themes that either came from, you know, her body action, or particular themes that would surface in her symbols and metaphors. And we put those together in a dance, and we then videoed the dance, and she was able to look back at it. And she made profound statements about, wow, that doesn't look how I feel. And she was able to clarify the discrepancy between what was going on there again on the inside and how she was presenting and communicating on the outside. And that was one of the really challenging things in working with this patient, was that she had a lot of omnipotent thinking, that people could tell what she was thinking. And so she just assumed, by her posturing, that people would know what she needed. And so when she saw herself and knew it wasn't like what she felt on the inside, we were able to make that correlation with, if you are surprised by what you're seeing as the difference, how can other people know what you really need without speaking? It was very, very young developmentally, and thinking people knew what she needed, and her anger and rage that people then just didn't take care of her, and learning as an adult. So we use our words. And she was 35 years old and was had tried 2 attempts at suicide and was diagnosed with a narcissistic personality disorder and depression. So I felt like, and she wrote me a goodbye letter. We did a goodbye dance too. And then she wrote me a goodbye letter. And in the goodbye letter, she wrote everything she had learned. And it was really, really, it was really rewarding for me. But you could tell that, like I said, that our work together was impactful for her, and then obviously for me.
So I'm thinking about all of your mentors, all of your educators, all of your experience and the knowledge that you've kind of accrued over the years about dance therapy, and knowing that there are these shifts happening inevitably in the field and in the practice of dance therapy. What is it that you would like to see held on to or carried into the future of dance therapy as a practice?
Well, interestingly enough, Trudy said she hoped the field never became standardized. And, having served on the board myself numerous times, and, having chaired the approval committee as well as the education committee, where we just rewrote the standards of education, I've always thought, what would Trudy say now that this is happening? Then I'd be curious as to, what Joan would say about what Trudy would say about the standardization of our field. I think, that question is just, I don't know, I think one thing that comes to mind in answering that is around 1999, I think it was. I believe Sherry Goodhill was the president. We had to make some decisions about whether we brought in the National Board certifying counselors. Did we affiliate with counseling? And what would that mean to our profession? And I would say that that's a dramatic change that took place. And I even, created a new program, a Master of Arts degree in dance movement therapy and counseling at Columbia College Chicago, so that we could meet the state board requirements and our students could sit to become professional counselors. And I really did that with mixed emotions. Is this the right thing to do? Do we find with counseling? What will happen to the dance? And I think that's the one challenge that I'm still, I have mixed feelings about. I know it made a huge impact on employability in Chicago and Illinois. And I can honestly say that, our students that did continue and get their LPC and then later their LCPC employment is no problem. So on a practical level, I think knowing that jobs are there, that we made the right decision. On the other hand, I've worried that the dance, the spirit, and I really believe our spirit comes in through the dance. And sometimes I worry that tempered the art form and the vitality in the art, because there was so much emphasis on counseling. And one of the things that we did in the program when I was chair of the department was we made sure in every class there was dance and movement. And I think psychopathology was the only class we didn't have movement and dance. And I felt good about that because that was really important to me, that we continue to emphasize the dance. Although I'm not sure that in the jobs that people have today that they're able to incorporate or find ways to creatively still include the dance in the creative process within a therapy session. So, I've been working personally on, I developed 15 fundamental mechanisms of dance movement therapy years ago, and I've narrowed that down to 9. And now all this research is coming out about it, which I love because it's, it's validating some of this work I'd already done. And I do think there's movement back to looking at and not describing our work through counseling and or through the mental health field, but through aesthetics and the creative relationship and what I call aesthetic mutuality, where we embody the culture. And that's what we're drawn to in the therapeutic relationship, which can evolve and develop the therapeutic relationship and really assist in being culturally responsive and responsible to people's interests based on their cultural experience. I would just say to continue to pursue more of the dance and the movement with less emphasis on the counseling, and obviously the psychopathology. I think there's already been a trend to obviously not use the DSM as the Bible, but that we go to the humanness of each person we encounter and develop and move and create together from there. So creating breeds creating, and that's kind of my motto. And that's what Trudy provided for me. She, she created with us, and that gave me permission and support and courage to be creative and explore deeply myself. And that's what I try and bring into the therapeutic session when I'm working with people, is let's find your dance and see what you can learn from it.
Is there anything else that I have not asked about that you would like to share or expand upon?
Rereading my little book of all the notes I took, from so long ago and working with Trudy, I've felt, like I said, quite nostalgic. And, this has been a very neat way for me to look back at the arc of where I began and where my interest was developed through Trudy into becoming not only a dance therapist, but an educator. Yeah, I just want to thank you.
Yeah, of course.
Yeah, it's
So
been a lovely little walk down memory lane.
good. I'm glad. So to wrap up our time together, I've been inviting interviewees to engage in just a little bit of movement. So I'd like to offer that invitation to you as well. I will join you, but if you'd like to share just a little movement for us to close up our time together.
Well, I would say this rounding. We would jump and round our bodies. Trudy did a lot with jump and fear, like, because jumping is frightening for the schizophrenic, according to her. So when we would jump, we would, jump with different ways and different patterns. And, I remember going and jumping through the space, and I don't have a lot of room to do it right here, but, and jump and turn. Not that it's a tour on l'air, but, and how do you embrace and say yes to your environment and yes to your center? Yes to me, yes to you, yes to the world, yes to Emmy, my puppy, who's looking at us funny right now. So I'll never forget, she said, people can't find their center unless you teach them or help them to activate their core. And so, jumping and reaching and kind of folding, you definitely feel your center in your core. So as you do that, jump. Whoop. Whoop. You feel that?
I do.
I really wish I had more space and I'd do it turning. Now I'm going to have to go and find a spot to do that in the snow.
Yes. Oh, thank you.
You're welcome. Thank you.
So, Susie Imus, it's been such an honor talking with you and hearing your stories about Trudy Shoe and your kind of trajectory through dance movement therapy. So I just want to thank you so much for talking with me and jumping with me. It's been just, it brought me a lot of joy. And I think that is the spirit of Trudy. So I'm just filled with joy right now. So I want to thank you for our time.
You're so welcome, and thank you. I really enjoyed it as well, Jacelyn.